And then our last slide for you on, thank you, page 7. Describes the state staffing. Last year in the budget, funding was provided and authority for a position to be dedicated to APS issues. We are very fortunate to have Lori Delagrammaticus join our staff to fulfill this function. She has a great deal of respect in the adult protective services community and is providing great leadership here on a number of things, including applying for a federal grant to do some data reporting work that we're working on for submission to the feds in the middle of May. And this slide, I won't read it to you, lays out all of the responsibilities that she's carrying out for us at the state level.
And you think the single position is adequate for the nature of the work?
One can always do more with more.
Good answer. LAO, finance, any comment? Okay. Let's move on to issue 17 for the proposals for investment.
Sorry,
You could have gone to the other side. Jorge Salcido, who's an APS worker for LA County in the Adult Protective Services Unit.
Thank you, Madam Chair. Members, I'll introduce Mr. Salcido. Kathy Sunderling with the County Welfare Directors Association, along with the California Commission on Aging and the California Elder Justice Coalition. We're putting forward this proposal to create a statewide training academy. As you noted, we're estimating the cost of that at $5 million. As you're seeing the increased number of reports come in, as you're seeing the aging population, we believe making sure that we have a really prepared workforce, a professional workforce, is really critical. The $5 million pales in comparison to what we spend on CPS every year for training, and we think it's just an important start to make sure that we are able to provide that services. Mr. Salcedo here today with us has 16 years of experience with the APS program for the County of Los Angeles, and he'll speak a bit about the need for the training and his experiences in APS.
Thank you.
Good afternoon, Madam Mitchell and members. My name is Jorge Salcedo, as she mentioned earlier. I'm honored and privileged to discuss the importance and great need for training in the field with regards to the work that APS conducts. Earlier, I had a lot of information. Good thing that the meeting has gone long enough to where I was able to condense some of the information. I'm here to testify on behalf of the broad coalition that includes SEIU California, California Elder Justice Coalition, the California Commission on Aging, and the County Welfare Directors Association to urge your support to provide $5 million to establish statewide and coordinated APS training programs. I have been with APS, like she mentioned earlier, for 16 years. When I started with APS, there was little formal training for new workers. Sadly, as of today, nothing has changed in the last 16 years, and unfortunately, due to new mandated reporters like banks, our caseload has skyrocketed tremendously. New workers do not have the necessary training before they take on the high caseloads, and seasoned workers do not have the ability to assess regular advanced level trainings. Unlike DCFS and Department of Public Social Services, when workers come on board, they have an academy, a 6-month academy. Us with APS, to be honest with you, very little training is done. We're given a welfare institution code book, we read, we shadow some of the social workers, and we go out in the field. And I think there's a great need for training, especially knowing that we're dealing with the most vulnerable population. That means our elderly and dependent adults. And most recently, as you're well aware, Vietnam vets are now in that category of 65 and over, so they've become themselves seniors. And it presents a very difficult situation because now we're dealing with a lot of complex situations where it deals with being able to differentiate between a mental illness and a cognitive illness. And for myself, over the time, being on board 16 years, I've had the training and the experience to know how to differentiate. But for new workers that are coming on board, we need the ongoing training for they can be able to better assess the situation and diagnoses. I have some example of cases, but
give me one example.
I'll give you an example. I most recently had when you say recent, just 3 days ago, I went in to deal with a case where it involved an elderly lady. And luckily, I have the training enough to know that she was not suffering from any cognitive issues or mental illness, yet somehow the children were able to draft 2 letters from 2 different doctors that documented that she was cognitively impaired, unable to make informal decisions. She was not cognitively able to make financial decisions or in her best interest in terms of her well-being. After talking to her, I come to the realization that, there's something wrong here. But what's important here is that this lady, after she was diagnosed by these 2 doctors, 8 months after, she took it upon herself to be seen by a neurologist. And unfortunately, because the neurologist is not a board-certified doctor, it's not valid. But based on the comprehensive documentation, based on her capacity, it stated otherwise, that she did have capacity. And this is a heavy-duty case because it involved an estate. She was moved into that boarding care facility. She had an estate that was worth $2 million, and it sold. All her living trust, all her property was put in a trust, and now it's being managed by the daughter who has power of attorney. And there was also a Model A car, which was her husband's pride and joy, who has since passed away. The good thing, she has a pink slip, so I doubt if they're going to be able to sell the car. But that's an example of the training because of the experience that I've had, that I was able to determine that this is not right. And luckily, in the community, we have mental health agencies where I'm going to take it upon myself to make sure that this client gets assessed and diagnosed by MD to state otherwise and revoke that power of attorney and give this lady back her dignity. So that's just an example of what we deal with. But again, I think it's important that we focus on training for the community that we serve. An example of that is we have very little training on health issues. Very few of us know issues and concerns about scabies, bed bugs. What do you do? How do you come in? Do you do not come in? You got training in the field and the safety, how to deal with a situation, an aggressive perpetrator. How do you deal with him? If he comes at you, how do you defend yourself? CPR. I've had 3 different situations this year alone. One was very serious, where I walked in and the elderly lady was literally, she was suffering from lack of oxygen. If I had the training, the medical training, it could have been, luckily I was able to get on the phone with the paramedic, and he was very patient, and I was panicking to some degree because the lady was going through her episode, she was going through a seizure. He was able to train me and guide me to the point where I was able to keep her focused until paramedics got there, but we don't have the training. Situations with animal control. How do you deal with an aggressive dog? What are some of the things that you need to do when you're coming into a home? Now with the banks being mandated reporters, luckily, because of the experience, again, that I've had, I'm able to deal with the situations, but we're dealing with real estate fraud. We're dealing with international scams. There's so much training that's we're in dire need, not only so much for ourselves, for the social workers, but also important for the reporters that are making these reports. How to appropriately make a referral to us. A lot of the times, I saw a lady here, she's with Ombudsman. We get a lot of reports that come to us that should be directed to Ombudsman. If the abuse happened in the facility from a caregiver or a staff or a resident, that's strictly Ombudsman. We handle situations that are being affected outside in. So those are some of the things, and again, it is essential that both new and seasoned APS social workers in all counties have equal access to the most current and advanced trainings and tools available in these areas. Training will enhance our ability to intervene quickly to stop the abuse, prevent further harm, and assist our partners in the community, the police and district attorney, in identifying prosecution of elder abuse. Lastly, our community depends on depends on us to serve and protect our clients and provide them with the highest quality of services. This proposal would ensure that all new social workers, seasoned social workers, supervisors, reporters have the skill sets and knowledge to protect and serve our elderly and disabled victims of abuse, neglect, and exploitation. I know we currently are getting 88,000. It just shocks me. Like I said, the population is growing. Vietnam vets are now 65 and over. I've been on board 16 years, and I will tell you, I've never been in a position where I've had so many cases. I have over 100 cases, and I'm just managing the best I can. Again, thank you for your time, and I ask you to please support this request. Thank you.
Thank you, I appreciate it. Ms. Cinderline, is there a model training, or will your ask include the development of a training?
There is some development work to be done, but there has been much activity in this area over the past decade. So I do think we believe we don't have to spend an inordinate amount of time doing that development work, that we can get that off the ground more quickly. We're lucky in that regard. There's been a number of the universities that we've worked with to develop some training. So we really appreciate the ability to present this to you today. It just seems time to really make sure that the system that so many people depend on has the necessary tools to be able to serve them.
Agreed. Thank you very much. I will open up to public comment on both the overview of adult protective services as well as the proposal for investment. We'll do 1 minute, please, each witness. Thank you.
Thank you, Madam Chair. Carol Sewell from the California Commission on Aging. We're pleased to partner with CWDA and the California Elder Justice Coalition in bringing this request back for our 3rd year. We just heard quite clearly how broad the responsibilities are of Adult Protective Services staff. What we forget maybe is that that's a continually evolving situation with electronic scams and phone scams and mail scams. It's a very changing scenario, and training is essential. In a very recently released survey that the LAO conducted for Assemblymember Brown on behalf of the Aging Committee in the Assembly, counties requested specifically or identified the specific need of additional training and additional quality assurance standards. Those were the things that were identified as their highest needs. They realized that they could do more if they had more. So we really support and urge you to approve this request when you come around to voting. Thank you.
Thank you very much. 1 minute, please, each witness.
Gary Passmore, Congress of California Seniors, were strongly in support of the APS proposal and want to remind you that it's often the case that if we have effective APS services that can intervene fairly early on in the decline and exploitation of someone, we're also saving the state money long term, because many of those folks are literally dehumanized as a result of what's happened to them and end up in institutional care. Thanks.
Thank you, sir. Next witness, 1 minute.
Hi, my name is Rachel Tate. I'm representing the Los Angeles County Long-Term Care Ombudsman Program in support of the APS funding for training. Our agency works closely with APS, and with the increase in their caseloads, the complexity of their cases, and the staff turnover, funding for training for them is absolutely critical to turn elder abuse victims into elder abuse survivors.
Thank you. Next witness.
Yes, Darrell Kelch with the California Association of Area Agencies on Aging. Our agencies are seeing daily the numbers of elder abuse, and working in collaboration with their local APS. It's an issue that's just is going rampant. I can tell you, just the other night I went home, had a message on my phone, and there was a call saying there was the IRS saying, you know, I'm in trouble, call this number. I mean, so it happens to all of us. And if you can imagine being 80, 85 years old and getting that kind of call, you just panic. So it's an important issue. We got to have the professionals. We got to have the training, because the types of scams are constantly out there changing and evolving.
Good afternoon. Lisa Coleman with CalCOA, the California Long-Term Care Ombudsman Association. And we hear about this all across the state, the complexity of the complaints that the APS and the Ombudsman program are addressing. And the efficiency in which we can resolve these complaints is in great part predicated on the knowledge of what's the best next step. And better trained field people mean we get to that next step and we assist the seniors faster and more effectively. So please support.
Thank you. Next witness.
Good afternoon, Madam Chair, members. Martha Guerrero, representing the Los Angeles County Board of Supervisors. And as you heard from our veteran APS worker, the workers are confronted, with all these challenges out as they're doing their work, and delicately need to handle the investigations to protect those that are vulnerable. Thank you, and we are in strong support.
Good afternoon. My name is Isaac Taggart. I'm with the San Francisco Long-Term Care Ombudsman Program and a member of CalCOA, the California Long-Term Care Ombudsman Association, in strong support of this funding request. In San Francisco, we have a very strong collaborative relationship with APS and view this funding as critical to the ongoing development of adult protective services statewide. Thank you.
Yes, good afternoon. My name is Alejandro Ostos. I'm with Los Angeles County. I'm also an APS social worker. And I'm here just to reiterate the challenges that my friends and my brethren face daily, and I ask that you support this proposal. Thank you.
Good afternoon, Madam Chair, Senator Monning, Joe Rodriguez, California State Long-Term Care Ombudsman. I certainly understand and value the importance of well-trained staff, and with that in mind, I ask for your support for our colleagues in APS. Thank you.
Good afternoon, Madam Chair and Senator Monning. Rosanna Carvacho here on behalf of the Alameda County Board of Supervisors in strong support of the proposal to provide training for APS workers. As you've heard and the testimony provided, these are very complex cases and very to little no training, whereas everyone assumes that these APS workers have the same training that CPS workers are, and they are not, and this population just continues to grow. So therefore, we respectfully ask for your support of this training proposal. Thank you.
Rebecca Gonzalez, National Association of Social Workers, California chapter. This is a growing area for social work because the population is growing, and we strongly support these training funds.
Melissa Flaherty from Stanislaus County Ombudsman Program. We strongly support the APS funding, being in collaboration with APS on a regular basis. Anything or any training that they receive will be beneficial also to the Ombudsman Program.
Clay Kemp, Executive Director of the AAA of Santa Cruz and San Benito counties, and also California Association of Area Agencies on Aging, Legislative Co-Chair. I'm also speaking in favor of the enhanced funding for APS training. And just one comment that I want to add that we haven't had so far is we're working on June as Elder Abuse Awareness Month, and C4A will be promoting the broader issue to make sure our community's more aware not only of the issue, but hopefully if this funding comes along, we'll have some more resources out there that we can highlight some of the skills that we'll be learning in order to address this really serious issue. So thank you.
One more, Madam Chairman. John Pointer, California Senior Legislature. We support this funding proposal.
Thank you.
Department of Social Services and some of your other spring finance letters. We'll be looking at issue 18 and 19, transfer of commodity supplemental food program, and the Title IV-E Wellbeing Project budget bill language.
Again, Pete Chervenka with Social Services. In contrast to some other things, this is fairly straightforward. We're simply proposing dollar for dollar a reduction at Department of Education and an increase at our department. Both departments concur with this transfer of the program to us as a result of changes made in the federal Farm Bill, a program that formerly served women, infants, children, and seniors that was operated by Department of Education became a low-income seniors only program. And we have a great relationship with 5 of the 6 food banks already that this program works through, and the departments collaborated well. They have an offsetting BCP to do exactly the offset for what we're doing. So request your approval when the time comes of that proposal.
Excellent. LAO, Finance, any public comment on item 18? Seeing none, we'll hold the item open. Issue 19, the Title IV-E.
And the Title IV-E, this is our federal waiver that we have 9 counties representing 50% of California's child welfare caseload participating in. As you're aware, we also have what's known as the Approved Relative Caregiver Program in California, or the ARC program, that was something that we did in the state budget fairly recently to assist payments. And we're simply asking for budget bill language to move any of that funding between where it's appropriated and the appropriations for the waiver counties, so that this is purely a technical adjustment that we're asking for. It's cost neutral, but allows us to move money to the appropriate item for the waiver counties.
Any comments by LAL Finance? Committees received no concerns about this issue. Any public comment? Seeing none, we will hold this item open as well, sir. We'll move on to items 0530 and 5180, Health and Human Services Agency, OSI, Office of Systems Integration, and the Department of Social Services. We're on page 43 of the agenda. We're going to hear about the budget change proposal for case management information and payrolling system. Then we'll move from there to the spring finance letter. First, the budget change proposal.
Okay, good afternoon. Cynthia Talker with the Office of Systems Integration. Thank you very much. So CMIPS is the case management system for the in-home supportive services program, and the OSI CMIPS BCP is requesting a budget year OSI spending authority increase of approximately $4.8 million and a corresponding request of $8.7 million to the Department of Social Services local assistance. The $4.8 million in spending authority includes an Attorney 3 position. We're going into needing to procure another M&O services vendor for the CMIP system, and we'll need some legal support during that time period. And then as well as it includes base operational costs as well for the current contract. And then the other $3.9 million to make up the $8.7 million is for state data center services. So that's a high-level summary. I believe the second question was with regards to the prime vendor costs and the adjustments. So we have about approximately $1.4 million. As more case information needs to be stored in the system and as the caseload grows, base transactions, just keeping the lights on work, more services are required, more transactional costs are required to support that. We also have with the FLSA with the travel form processing, and that's estimated to be at $1.7 million to process those timesheets that come in. And then for blind and visually impaired ongoing costs, it's roughly $1.5 million, and this is a new contract service, so it wasn't a specific budget item previously, and it includes costs for telephonic hardware and software and additional help desk staff in order to assist blind recipients when they call in for their timesheets.
LAO, any question or comment? Finance? Any public comment on CMIPS 2, the budget change proposal? Okay, seeing none, let's move on to issue 2, the spring finance letter.
Thank you, Madam Chair and members. The spring finance letter is for our County Expense Claim Reporting Information System, or CCRIS, as we call it. This system was actually approved way back in 2007 to replace 2 existing systems, which have been around almost since the dawn of time and require a lot of manual operation and hand calculations outside of the systems. Bad timing, 2007, the bottom fell out of the state budget, and these were put on hold for this amount of time. We spent a lot of time researching what the best new approach, since obviously technology had moved on quite a bit since 2007, have now come up with a, excuse me, a new approach that will involve crafting together a number of software packages, of which 90% the department already owns. So this proposal is to create 3 staff for the department over over time, as well as one additional staff of creating a permanent staff in OSI to assist with procurement and assist us as we're going through the procurement process to create a solution vendor, to get my acronyms right, solution vendor who's going to help us knit together those software packages to make sure that they all work well and work in the correct way. These are the two systems that allow the department to both provide county access and portals so that they do all of their administrative claiming and all of their local assistance claiming. So it is billions of dollars that go through these two systems. It's really critical that we replace them again because of all those hand operations that are done outside, and that will allow us to actually do a much better job of monitoring these accounts and spending and providing the federal government with the assurances that they need that we're claiming appropriately.
Thank you. LAO, anything? Department of Finance? Thank you. Thank you very much. So I think we're moving next to page 46 of the agenda, Department of Aging, item 4170. And issue 1 will be the overview. Did any test about public comment on those last ones? Nobody's did. Good afternoon. Welcome. The floor is yours.
Good afternoon, Senator Monning and staff. Laura Conley, the California Department of Aging.
Ed Long, California Department of Aging Deputy Director.
And I know you are very familiar with our programs, both at the state level and certainly at the local level as well, but just wanted to walk through a couple of updates in terms of some of the materials that are in the agenda very briefly, and then Ed Long is going to provide an update in terms of the MSSP transition in the Coordinated Care Initiative. The governor's budget includes $201.6 million for the Department of Aging. Most of that funding is federal in terms of its source. $151.5 million comes from the federal government, with $33.7 million coming from the general fund and then from other sources as well. I just wanted to note that in February, after the governor's budget was released, we received notices of award. The federal budget was passed very late in the year last year, and we didn't receive our notices of award until February. So we actually received an additional $3.6 million in funding for the through the Older Americans Act, and $2.9 million of that was specifically for nutrition programs. The others were for the other Older Americans Act programs. As you know, the department administers the Older Americans Act programs through contracts with the 33 area agencies on aging. They provide those services as well as the health insurance counseling and advocacy program, HICAP, at the local level, and they either provide those services, those home and community-based services directly or through subcontracts with local programs as well. The department also administers 2 Medi-Cal programs. It contracts directly with the agencies that provide the multi-purpose senior services program, that waiver program serving older adults who are nursing home eligible, but with that assistance and other supportive services are able to remain at home. And then we also certify the community-based adult services centers for their participation in the Medi-Cal program. The agenda outlines the Older Americans Act programs, obviously senior nutrition being the most well-known and largest of those programs, but certainly supportive services as well, senior legal services, family caregiver support, and the long-term care ombudsman and elder abuse prevention funding and services. Under the Older Californians Act is the health insurance counseling and advocacy program and the senior community employment program. I know the agenda traces the history in terms of some of the funding reductions that those programs have had over time. and provides that information. I just wanted to also mention, we've come before you in, I think, the past couple of years with BCPs related to federal demonstration grants that we have competed for, and just wanted to share that in terms of the chronic disease self-management grant, we're in the third year of that grant. We have outperformed all of the other states who have received this funding in terms of implementing these 6-week work groups, workshops that really focus on helping people manage their own chronic conditions, because most of it is self-management when you've got diabetes or arthritis. And that we have 16,000 adults have participated in these programs, and we have implemented these programs in various parts of the state in 10 languages, certainly speaking to the diversity, the great diversity in California. We will be talking about a little the CCI in terms of the MSSP update, but one of the other demonstration grants that we've had has been working with the Alzheimer's Association and Alzheimer's Greater Los Angeles to work with the health plans that are participating in CCI to help them better train their care managers and better identify individuals who are coming into their health plans that may have diagnosed or undiagnosed dementia, and better serve them and meet their needs. And that has been a really, really positive success, very well received by the health plans, and we have exceeded all of our performance goals for that grant as well. And I think at this point, would you like to continue with the update on MSSP?
Sounds good to me.
Okay.